Fitness to dive. Are you fit? By Dr. Franz Cronier. Recreational diving is a very popular sport. More than 6 million people participate worldwide. It is open largely to all who apply for training, and whereas 30 years ago fitness standards were stringent and all but the most perfect human specimens were admitted, the reverse is true today, in that all but the most frail individuals are excluded. This therefore raises the question, when do you know if a person's fit to dive? Being a voluntary and recreational activity, it may surprise you to know that medical fitness verification is not mandatory to participate in recreational diving. In other words, no one needs to give you permission. But it is required for those who train individuals to dive. Although this is largely due to a need to reduce liability, dive schools are really the only ones actively determining diving fitness. A diver's entry-level dive course may be the first and only fitness assessment hurdle they ever need to cross. After that, it's really up to the individual, or their dive buddies, to determine whether or not the individual is fit to dive. While diver training agencies may have different philosophies on diver education, it is a universal trend in terms of diving fitness assessment that a diver is only sent for formal diving medical assessment if they indicate a medical problem on the diving medical questionnaire, the one they receive as part of their dive training. So if they choose not to disclose a problem, and the condition is invisible otherwise, no one is likely to enforce the need for an assessment on them. So, for the most part, it is entirely up to the diver to determine the risk of diving with a given medical condition. Unfortunately, the diver is often not in the best position to assess the risk. They typically do not have the necessary background or objectivity to do so. The training agencies, on the other hand, don't wish to overemphasize the potential hazards of the sport, and they rarely belabor the implications of dishonesty on diving safety. For dive leaders and instructors who earn a living from diving, the situation is only slightly different. These divers have a professional responsibility towards their students or diving clients, and technically speaking, they are occupational divers and should be subject to the occupational health and safety legislation. But in practice, very few countries impose these standards on recreational diving instructors, so that, again, it is left up to the diver or their employer to deal with the issues of diving fitness. Once they are qualified as instructors, the requirement for diving fitness is no longer imposed. Having said all this, it is not the objective of this article to convince all divers to undergo formal diving medical assessment, although of course it's not a bad idea. Rather, it is intended to offer divers and dive leaders some essential perspectives on diving fitness, to allow them to make better safety decisions about themselves, and to explain the issues to those presenting potential problems. It will also assist in explaining the rationale and need for formal diving medical fitness assessment when those are indicated. So, are you fit to dive? With few exceptions, divers are no longer medically disqualified from diving on the basis of a medical diagnosis alone. Previously, labels such as diabetes, asthma, or epilepsy were grounds for immediate disqualification. Today, diving fitness assessments take the form of a more methodical risk assessment. The implications of the diseases or their treatment are measured specifically and weighed up against the inherent risks of diving, and then the decision is made whether the combined risk is acceptable or not. Divers are also more likely to comply with the findings, rather than simply doctor shopping until they find someone who's willing to release them to diving. Actual diving injury and fatality statistics have also favored general leniency by showing that former concerns were greatly overestimated. Nevertheless, certain disorders, like uncontrolled epilepsy, remain absolute contraindications to diving. This is not due to the diagnostic label. It is due to the inability to exclude the very real possibility that such individuals will drown while diving, due to a loss of consciousness. For most other medical conditions, the risks are individualized. Basic fitness requirements. There are essentially 3 basic requirements for diving fitness: mental, physical, and social fitness. Firstly, mental fitness. The diver must be conscious and alert enough to participate in the activity. They should be intelligent enough to be trained to do so, and psychologically and emotionally stable enough to apply the training and follow the rules. Secondly, physical fitness. The diver must be able to equalize air spaces, that's ears, sinuses, lungs, teeth, and even the intestines without problems. They should be free of incapacitating illness and injuries or the risks thereof. They should be able to maintain exercise levels required for diving, and they should be able to wear and use their diving equipment effectively and safely. Thirdly, social fitness. The diver should not impose undue liability to the dive school operator or instructor, and they should be able to meet their responsibilities as a buddy diver. The most common risks are related to physical requirements, and for the most part, physical fitness is based on 1, whether or not exposure to changing pressure would be harmful, and 2, whether the individual is able to respond to and exercise within the diving environment without undue risk. Although by no means exhaustive, for each of these 2 physical requirements there are a number of diseases, which we'll mention now, where fitness cannot be assumed without a proper assessment. The pressure issues may include conditions such as middle ear infections, eardrum perforations, sinusitis, lung collapse or pneumothorax, asthma, bronchitis, upper respiratory tract infections, hay fever, poor dental fillings, earplugs, and hollow or false eyes. Next, the issues related to responsiveness to and exercise tolerance within the environment. These might be affected by epilepsy, fainting spells, cardiac arrhythmias, so-called hypertrophic obstructive cardiomyopathy or thickened heart muscle, aorta valve stenosis, coronary artery disease, cardiovascular fitness issues, anti-hypertension medication, obesity, asthma, peripheral vascular disease, muscle dystrophy, mitral valve stenosis, thyroid disease, diabetes, psychiatric disturbances, medication, physical disabilities, extreme motion sickness, balance and coordination problems, neuromuscular dysfunctions, adrenal problems, physical disabilities and equipment misfits, Raynaud's disease, which is spasm of blood vessels, particularly in the hands and feet, peripheral vascular disease, vasculopathies, that's blood vessel disorders, and thermal adaptability problems, including those associated with thyroid disease. Matching diving to fitness. Diving fitness is not absolute. It should be matched to the planned diving activity. For instance, some dives are inappropriate, irrespective of very high levels of fitness, whereas others are low risk for even partially disabled individuals. When diving fitness is impaired, safe and appropriate diving may still be performed by limiting exercise and exertion, exposure, whether to heat or cold, elaborate or extraneous equipment, in other words, avoiding technical dives, extremes such as depth or duration or decompression stops and distance traveled, decompression stop diving, ice or cave diving, trimix or deep diving, strong currents and high seas, shore entries, and tough boat launches. It is to be noted that certain minimum levels of physical fitness must be present to be able to deal with sudden changes in environmental conditions or emergencies. Armed with these perspectives, we hope it will be easier to understand and also explain the importance of diving fitness and to identify when and how medical conditions may affect an individual's safety. When in doubt, call Dan on 0800 020 111.